Well, welcome everyone. It's nice to again see everybody. We had our Go Red ELT that just preceded this, so we're all queued up and ready. We're excited to learn about the state of women's health. Before I introduce Megan, I just wanted, for those that may not know me, that are on today's session, I just wanted to share a little bit about myself and my story and why the Go Red campaign means so much to me, and why this, as an ambassador of women's health, I'm really engaged in this campaign. So I'm Pam Simons. I'm the VP of Clinical Affairs at AtriCure. I have worked in cardiovascular clinical research for my entire career. And so I'm very, very clinically tied to research, and I'm very familiar with the work that the AHA does. In 2017, I had the unfortunate experience of losing my husband very suddenly to cardiovascular disease. He was away on a business trip. He was a local broadcaster here in the Twin Cities, and he was away covering spring training for the Twins, and he passed away suddenly. And all of a sudden, I was a widow and a mom of an 11-year-old daughter. And the path of my life changed tremendously. And all of a sudden, women's health and taking care of myself and modeling good behavior and modeling good health practices, and it really became super important to me. And I really need to put myself first in terms of taking care of my health, which is very hard for women. It does not come naturally to all of us. And so the Go Red for Women in the Evening of Empowerment and these State of Women Health initiatives are critically important to me. They're very inspiring to me, and really fits in so nicely with the overall American Heart Association mission. And I am just honored to, in some small way, to contribute to these missions. So I am super thrilled today to listen to the state of women's health, and would love to introduce Megan Ely, the consumer health lead for women's markets and relationships with the American Heart Association. And Megan, I'm going to turn this over to you because I know that we are all so excited to hear what's happening and what is the state of women's health. So it's all yours.
Thank you so much, Pam, for the kind introduction, sharing your story. And I have to say, your willingness to volunteer and bring together conversations like these is not a small way at all in terms of contributing. Our work is only possible because of the volunteers like you. And so I'm immensely grateful for everyone on this call for not only joining today, but just being a part of the Go Red for Women movement, because none of this is possible without each of you. So thank you. So I'm excited to share a little bit today about not just what the AHA has accomplished, but also where are we going in the future. So if we want to jump to the next slide. We thought start by grounding a little bit in the AHA. So about a year and a half ago, the AHA really took a step back and said, where are we going to focus as an organization? What are our priorities? What are going to be the key pillars of our mission? And this slide was created, which we have adoringly called the Peacock slide ever since, but it highlights these 5 key areas that the AHA is committed to addressing to improve health for all Americans. And equity is, of course, at the center of these. And you see that each one of them, has different key points to it. But one of the things that is so important for me whenever I look at the Peacock is women's health is one of our top priorities. It has been for decades, and it remains to be a key priority for the AHA. And so as we think about how can we improve the health of women, we are really focused on how can we reduce risk for women. And like Pam said, for many women, this may not be the thing at our top of our to-do list. We have a lot of other things going on. It may not come naturally, but how can we focus on women's health and make sure that all women have the chance to live their best lives for as long as possible? And when it comes to why women's health is such a key important issue for us, the simple fact is cardiovascular disease is still the #1 killer of women. And in fact, cardiovascular disease kills more women than all forms of cancer combined. It is an alarming statistic, to say the least. 1 in 3 women will die from CVD. And as we think about even younger women, 45% of women over the age of 20 are living with some form of CVD. This has to change. So as we think about how can we really move the needle on women's health, we know that women also experience unique life stages that put them at an increased risk for CVD. So that's something we'll be talking a little bit about this morning is how can we help women across their entire lifespan, because we want to make sure we are removing that risk for women and reducing their risk by removing the barriers that they face to experiencing good health and well-being. So if we jump to the next slide, as we think about Go Red for Women, Go Red was founded in 2004 as our signature women's health initiative. And there is so much we can be proud of over the last 2 decades. In fact, I could talk for days about all the things that Go Red has done over the last nearly 20 years. But I picked out a couple of the key things that I think are really important as we think about where we come and where are we going in terms of how the AHA, Go Red, and then all of our incredible volunteers like you have helped us make a difference in women's health. So the first, let's start at the beginning. So we are founded in 2004 to really help move the needle on women's health. But in 2004, we also launched the very first women's focused treatment guidelines for cardiovascular disease. It's an incredible milestone as we think about how are the physicians in the United States caring for women, and how are we helping them make sure that we are caring for women based on the latest research for women. Then in 2006, we launched our very first international license in partnership with the World Heart Foundation. Why this is so incredibly cool is today we have nearly 50 countries that have Go Red for Women programs around the globe. When you think about the impact of Go Red, it's not just in our own communities and across the US, it truly is a global brand that stands for improving women's health around the world. So we continue to see that expand and grow over time and are so excited by the way the movement has taken off around the world. Then in 2010, we successfully advocated for federal policy changes that barred insurance companies from charging women higher premiums for the same health insurance coverage as men. It's absolutely astonishing that just 11 years ago, we were fighting for equity when it comes to health insurance care. That is such a key place where Go Red has played an important role and will continue to play an important role is in our advocacy work and standing up for women to ensure women's health remains a top priority. Then in 2011, we released a scientific update on the prevention of cardiovascular disease in women. We are continually updating our science based on the latest knowledge. And I think that's one of the important things to remember about Go Red for Women. Science is always growing and changing. And so we are constantly bringing that new science forward to make sure that women understand their own risks, as well as those in the healthcare space. And then in 2016, one of my personal favorite milestones, we launched our first strategically focused research network. But you've heard us talk about strategically focused research networks. They're this incredible model that brings together multiple research sites to focus on one singular topic. So women's health was the priority for our Go Red strategically focused research network, but one center focused on gender differences in heart failure, another focused on poor sleep, another focused on pregnancy. They each had different parts of women's health that they were looking at, but they had the opportunity to collaborate, to share data, to share these conversations, because that's what we really want to make sure is happening, is our research is bringing all of these complex issues together so that we have the best solutions for women. That was a 5-year research investment with the findings from the SFRN being released earlier this year. So it's an incredible testament to the power of AHA's research that is only possible because of our volunteers like you. Then in 2017, another key milestone as we look at our science and research work, we made the organizational decision to no longer fund research studies that did not include women unless it was scientifically necessary. This is incredibly important as we think about how do we ensure women are properly represented in our research and our science. We have to ensure women have a seat at the table. And we'll talk a little bit more about that in a second in terms of what AHA is doing to specifically close that gap of women being represented in research. And then in 2018, we began to really focus on maternal health and mortality. And that really started coming through both in our research work as well as our advocacy work. And that's something we're continuing to build on and grow on and focus more on into the future, is that complicated intersection between pregnancy and cardiovascular disease and how that impacts a woman's health, not just during a pregnancy, but for the rest of her life. So, and then 2019, just 2 years ago, we launched Research Goes Red, which is one of our incredible initiatives to close that gap of women being represented in research like we were just talking about. So we partnered with Verily's Project Baseline to launch Research Goes Red and engage more women in research. Because the sad fact is, as of 2020, only 38% of clinical cardiovascular participants were women. 38%. We have to ensure women are included in research so that when you or I go to the doctor, we are being treated based on research on women. Women are not just little men. We are not just different. We have our own specific needs, and we need to ensure our research reflects that so that we can offer the best treatments and preventions for women and ensure that it is all based on their specific needs. So to talk a little bit about Research Goes Red and the incredible work that's being done there, what I love about it is one, that it is nimble. When COVID hit, we were able to quickly stand up scientific surveys focused on COVID and how it was impacting women and their own experiences. So often research can take a long time to get started. So the fact that we were able to quickly and nimbly meet the needs of women right now is huge for us. The second is we announced our first 2 funded studies, and I'll share a little about one of them in particular because it really defines what Research Goes Red is designed to do. When we first launched Research Goes Red in 2019, we asked women, what are your top health concerns? What keeps you up at night that you are worried about related to your health? The number 2 answer that came back was weight, which is not surprising as we think about what are the things that women are worried about related to their health. So our scientific advisory group launched a new study, which is a weight phenotyping study in menopausal women, which basically means it studies women pre, peri, and post-menopause and the changes in weight over time. They weigh themselves with scales, have blood draws, they track what they're eating, when they're sleeping, when they're working out, all of these different things that impact their lifestyle so we can better understand women and weight and changes to help bring that information to women so that they can have better informed decisions. And what's really cool about all of Research Goes Red, it's done remotely. You can do all of this from your own home. I have taken surveys on my phone sitting on my couch, if I'm being totally honest. But the fact that we're breaking down these barriers to research so that more women can be engaged in research is so crucial to our mission and what we're trying to do to ensure women have the best opportunity to reduce their own risk. So I could talk all day about what Go Red has accomplished. We have tons of exciting infographics that show some of our milestones over the 20 years, but I want to talk a little bit about, so where do we go from here? So if we go to the next slide, there's one particular study I wanted to call attention to. That's our Triennial Women's Study. So since 1997, we have tracked the levels of awareness in women on cardiovascular disease, risk factors, warning signs, all of these key things. The study is published every couple of years in our flagship scientific journal, Circulation, and this particular edition studied the awareness levels of women in cardiovascular disease over the past 10 years. So there's some good news and some bad news. The good news, the women inspired at the inception of Go Red for Women have championed women's health since 2004 and are still the most likely to recognize heart disease and stroke as their greatest health threat. In fact, 61% of women could recognize CVD as their leading cause of death. However, the study drew an alarming circle around the fact that younger generations of women, particularly Gen Z and millennials, are less likely to be aware of their greatest health threat and less likely to know the warning signs of heart attack and stroke. This absolutely creates an emerging trend that not just the AHA and Go Red for Women, but all public health organizations, government organizations, healthcare professionals, community organizations, we all need to double down on reaching younger generations of women, and particularly younger women of color, to ensure that they understand their own personal risk factors and are equipped with the resources to address them. AHA has already committed to this and continues to be firmly committed to this through Go Red for Women. We know that this is vital and that we will address this for the younger generations. So, and one other thing about this study that was so interesting is while it showed that women still worry about getting heart disease, they seem to have lost sight of the fact that it is their greatest health threat. Many would cite other things being their largest health threat, not understanding that cardiovascular disease remains that #1 killer. And if we think about it as women, we are inundated with messages all day, every day. Text messages, TV shows, messages from school, your work, your spouse, all these different people. Heart disease very often may not rise to the top of those messages. So how can we cut through the noise and ensure that women are hearing us and they are understanding the importance of CVD and risk prevention now for their life. So as we jump to the next slide, I want to talk a little about as we think about how do we relate to women? How do we cut through that noise and speak to them to become that trusted health partner? GoRed is really focusing on ages and stages. So we think about our lives, we don't often categorize ourselves as, women 18 to 24, or some of those ways that science may divide us up. Instead, it's about ages and stages and seasons. I describe myself often as I'm a mom of a toddler. That's who I am. That's my stage of life that I'm in right now. My mom is about to retire and enjoy the next season of her life. But that's how we describe where we are and how we're relating and seeking out different information. So as we think about women's health, the fact is, as a milestones of a woman's life change, so do her unique risks for developing cardiovascular disease. And so GoRed for Women is really going to be leaning in on these different ages and stages and seasons and relating that to women's health so that women understand how your current stage of life not only impacts your health, but what you can be doing to address that today. So there's a lot of different ages and stages and seasons, but I'm going to talk about 3 of the primary ones briefly that we're going to be really focusing on more as we try to reach more women, particularly younger women in the coming years. If you want to jump to the next slide. The first is maternal health. So a lot of people might be saying, why is the Heart Association worried about pregnancy? The answer is super simple when it comes down to it. Pregnancy and heart disease are intrinsically linked. And in fact, pregnancy-related deaths in the US have risen 140% over the last 3 decades. 140%. That is an alarming and terrifying statistic that we have to change because the root cause of it is cardiovascular disease. We know that we need to stand up for moms and help save them. Furthermore, cardiovascular disease during pregnancy can leave a woman with a higher lifetime risk of CVD later in life, as well as an increased risk for her children. As I think about my own pregnancy and those of my friends, things like gestational hypertension, gestational diabetes, preeclampsia, they shape a woman's long-term trajectory. My doctor and I never had a conversation saying you had gestational diabetes, so you are at a greater risk for cardiovascular disease later in life. That was never a conversation we had, but it was such an opportunity for me to understand my health and the fact that pregnancy can truly be a window into a woman's future health. So as we talk about our maternal health work, there's really 2 things we're trying to address. The first is helping women have safer and healthier pregnancies. So how can we help women be healthier pre-pregnancy, during pregnancy, and postpartum, helping them understand different risk factors, understand signs and symptoms of different conditions, and then also understanding that long-term risk that may come from a pregnancy-related condition. So how can we help women understand that pregnancy is such a key moment in her life for her own health? So we jump to the next slide. The next one is kind of a continuation of this, but talking about moms. For many women, they choose to become moms, which is a crazy, wonderful season of life. But so often, that season of life is focused on others. I have said openly, my 2-year-old toddler, who I adore, dictates what I eat, how I spend my time, and whether or not I'm going to sleep. But as we think about the impact that has on my own health, it's drastic. So how can we be helping women to make healthier decisions for their children, for their family, and by extension, for themselves? And so much of this is about how we talk to women, how we relate to them, how we share content. I've joked with our social media team that it's about 5:30 when I'm typically scrolling Instagram thinking, what am I going to cook tonight? So how can AHA be in the right spaces to have those conversations with women in a truly relatable, honest way about making those healthier decisions for their children and ultimately for themselves? How can we make it be the easy choice to have a little bit more vegetables at dinner, to go for a walk as opposed to watching Paw Patrol for the 50th time? How can we make that be the lifestyle that women want to lean into? And it's by having these easy tips and resources that are truly relatable for where they are in life right now. As we jump to the next slide, another key stage for many, many women is menopause. And I'll say, first and foremost, going through menopause does not cause cardiovascular disease. However, when a woman finishes going through the menopausal transition, her risk for CVD is significantly higher. So how can we help women make those healthier decisions and help them understand their own risk factors and make lifestyle changes pre-menopause so that as they enter the menopausal transition, they are reducing their risk for the rest of their life? There's so much that we need to learn and understand about the impact that menopause has on a woman's body. So there is so much more research we need to do in this area, but we know that it's a critical time for women as we look at those key milestones in a woman's life and how can we be supporting her and helping her reduce her risk each step along the way. All of these different stages have their own unique challenges and women have their own unique needs. But what I think is the most incredible thing about Go Red for Women is we have the ability to be that trusted health partner through all of these stages and seasons of life. So whether it's a young woman who's thinking about possibly starting a family, a mom who is in the thick of it with a whole bunch of kids, or a woman who is starting to start the menopausal transition, Go Red has that ability to walk hand in hand along with her, not just caring for her unique needs now, but helping her prepare for her needs in the future. So as we go to the next slide and talk a little bit about, so what can you do? There's a lot of things that we can do, but I picked out 3. The first, join Research Goes Red. Help us close the gap and ensure that all of our science and all of our work is as inclusive of women as possible. So by joining Research Goes Red, you can help ensure all of the science and care is based on research for women. The next, mark your calendar. Heart Month is just around the corner with, of course, National Red Day coming up, and then the Twin Cities Go Red for Women event. And then last and possibly most important, share the word. Think about all the women in your life. Think about your daughters, your sisters, your aunts, your friends, your coworkers. Every single woman benefits from hearing about her own health and helping her take charge of that today. So share the word and help support other women and share things like the local newsletter with them as a way to start a conversation about how they can take charge of their own health. So, and with that, I'll turn it back over to Pam and Jackie.
Thanks so much, Megan. Apologies, did I step over somebody, talk over somebody? Okay, thanks so much, Megan. Man, I'm just looking at the chats and everything. This was such a great presentation. It was so inspiring and I learned so much. It's like, I want to be a part of the Research Goes Red and I want to be a part of that menopausal study. Like, how do I do that? Like right away. So thank you so much. It was so great. And so much good information, data, stories, and ask. And it really, again, just solidifies for me why I'm involved in this campaign. You touched on so many points that are personal to me. So thank you so much for that.